Thank you so much. Your Excellency, Mr. Vice President of Ghana, High Commissioner, ministers, government delegation present, Your Excellencies here, and spouses of ambassadors, and all of you dear ones who've come to support us today. Thank you so much for coming and making the time to join us. For those of you who've been to my office, there's a plaque which quotes Dr. Martin Luther King Jr., and I'll paraphrase what he says, and he says, life's most important and pertinent question is, what are you doing for others? So for all of us who find ourselves in positions of privilege, it should also come to us as a position of responsibility. So as you enjoy the privileges that you have, you should ask yourself, how are you empowering others with it? How is it a blessing unto others? Because we see all around us that you may not necessarily be the most hardworking person to be the most successful person. So why did God choose you to be in that lucky position that you're in? So for that reason, I take where I am very seriously, and I believe I ought to also do something to impact others. It's easy to just ride the wave and just enjoy the perks of being the wife of the vice president, but I believe I also need to impact others, as I have been privileged to be in this position. So the Samira Empowerment and Humanitarian Project is to do just that. So we focus on 3 areas. But first of all, it's a not-for-profit organization which was established with the purpose of empowering the underprivileged in Ghana through diverse social interventions and projects to improve lives. So that is really the point of the NGO. So key to achieving these are the reduction of child and maternal mortality rates, improving literacy and critical thinking among children and students, training health workers, retooling health institutions, and driving entrepreneurial development among women. CEP, as it's known, collaborates with a number of local and international corporations and bodies to fulfill its goal to support Ghana in achieving the Sustainable Development Goals. So the mission of CEP in health is to provide vital health interventions to deprived communities and medical institutions. In education, we are committed to developing a generation of critical thinkers able to compete globally. So I'm very grateful for these scholarships that have been given us. Thank you so much. And in women's empowerment, we wish to facilitate self-sufficiency in women to help break the cycle of poverty, empowering women in Ghana with relevant tools, skills, and opportunities for them to thrive. So under these 3 main themes that we have under CEP, projects. So as I said, it's Samira Empowerment and Humanitarian Projects, and I chose projects because sometimes you need to match needs with opportunities. So you go some places and there is an opportunity for something, you should be able to be a vessel for that. That's why we chose a projects approach for our work. So in health, our flagship project is the Safe Delivery Project. The Safe Delivery Project seeks to reduce maternal mortality and neonatal mortality within a 5-year project phase. The project endeavors to distribute 100,000 birth kits to expectant mothers in their 3rd trimester in deprived communities in Ghana. The main objective of the project is to improve the survival chances of mothers and newborns by addressing the major causes of maternal and neonatal mortality. So when we were looking into what interventions we're going to do, especially in the area of maternal and neonatal mortality, we looked at the data, and we're working with the Ghana Health Service on this. So they provided us with their data, and we realized there were 3 main causes of maternal mortality, which is hemorrhaging, postpartum hemorrhaging, which is the woman bleeding to death after delivery, and then hypertensive disorders is also one of the main challenges, and then infections. So the question was, how do we deal with these three main challenges that contribute to maternal mortality? And that's how we came up with the Safe Delivery Project. So basically what the project is that we distribute birth kits to expectant mothers. Now these birth kits contain supplies that would ensure an infection-free delivery and neonatal care as well for the umbilical cord of the baby, which is the primary reason children get infections and go back into hospital and get even bigger infections and end up dying. So that is the idea behind it. But infection is just 7% of the problem. The rest, 38%, is hypertensive disorders and 34% is the postpartum hemorrhaging. So this kit tackles, if works effectively, the 7%. But how do we integrate it with the other nearly 70+% to make it effective? So what we decided was the woman who's eligible for this kit must have attended antenatal services in her at least once in her third trimester. Now, why did we decide on that? Just to make sure that if she's attending antenatal care and she has hypertensive disorders, they would catch it and manage it for her. Because in Ghana, we also have health insurance for mothers, but because of some of our traditions and the remoteness of some of our communities, the women do not go for that care. But we use the antenatal care obligation to lure them in to get the kids, and hopefully they can get managed. Now, so then the other part is the postpartum hemorrhaging, which we manage with medication. So that medication is in the kit and provide for the mothers. Now, like I said, because of some of the cultural practices and the remoteness of some of the communities, women are not able to access health facilities. But the ultimate goal of this project is to encourage skilled deliveries. And when we talk about skilled deliveries, we're talking about deliveries by a trained medical professional. So be it a doctor or a midwife or a nurse, because that improves your chance, the woman's chances of having a safe birth. And so we train the traditional birth attendants who are in the communities who normally deliver these children, and also incentivize them to take the women to hospital. So if, for instance, she was going to get, say, 100 rupees for delivering the child at her center, we give them an incentive so that she takes the woman to the clinic and we still give her that amount of money. So we've started this in one district, the worst district that there is for maternal mortality in Ghana, because we want to concentrate it and show with data. And as we go along, we're taking data, we're analyzing the results to make sure that this is an intervention that works and that can be scaled up and replicated in other areas. And I'm glad to say that since we started a little over a year ago, no woman has died of any of those causes in Ghana. So as part of the work that we're doing to complement that, we also realized that some of the causes of delivery, so I spoke about hemorrhaging and all of that, but sometimes it could be just a simple equipment that can affect that woman. So beyond, those are circumstances beyond the woman's control. So for instance, a remote community where she has obstructed labor and they need to perform emergency C-section on the woman. But unfortunately, there's no anesthesia machine. So even if there is a doctor, that service cannot be provided for the woman. So she has to be transferred to a bigger hospital or a bigger clinic. And it's a perilous journey. So she may either lose her life or the baby's life along the way. Sometimes it is things like even beds are not available. Sometimes it is even the delivery kits that are available. So a woman has to wait for another woman to be delivered. They sterilize before they come, or sometimes they don't even sterilize properly because it's urgent. They need to deliver the other woman. So these are some of the little issues that affect maternal mortality. So as part of what we do, we also collaborate with donors to provide support in retooling health centers as a complementary effort. So you deal with what is within the control of the woman, and then you deal with also what is what would work within the community. And that's what we do for facilities. But that is a broader program that we do across the country. So we identify what we call CHIPS compounds in Ghana. These are community health centers, very small ones, and then some of the major clinics, and then we provide them. Even some of the big hospitals, when we get supplies that can help their surgery department, we give them. We make sure that we match equipment to the capabilities of the health facilities. So if we have neurosurgery equipment, we're not going to send it to a clinic that doesn't perform neurosurgery. So we make sure that they actually will be functional and would meet the needs of the facility. So that is basically what we do in terms of the healthcare. Well, I also, as part of advocacy with the National Pharmaceutical Policy, for instance, with Ghana Health Service, Ministry of Health, there was a pharmaceutical policy that was launched, a maternal and child record book that we also worked on with JICA, nurturing care framework, which we worked on in conjunction with UNICEF, and an adolescent reproductive health project, which we also worked on with DFID, which is an NGO from the UK, and the Ghana Health Service. So these are some of the interventions we're doing in the area of health. Now, in terms of education, we know the fastest way to develop a country is through education. In fact, even with healthcare, it's proven that an educated woman is more likely to have a safer delivery than an uneducated woman. So education is really at the heart of development. And to support the delivery of quality education, we have what we call a library in a box project, because you need a child to read in order to function. There are studies that have been conducted to show that children in second grade in Africa cannot read versus their counterparts in Europe, for instance. And this child needs to read to even be able to understand what they're being taught. So reading is very critical to learning. So we developed the Library in a Box project, which is supposed to support reading. And this is basically a simple but brilliant idea where for schools that don't have library facilities, so either the room to have a library in, or even the library without the shelves or the table, the desks where the children can read, we give them books in a secure box where it's watertight, dust-tight, and the children can actually borrow the books from the box as if they actually had a library on a shelf. And this has proved very useful. We've taken it to so many schools across the country. So far, about 37,800 pupils have benefited from our Library in a Box project. And we plan to provide about 500,000 books to pupils within a 6-year period. And as part of the way we gauge our success is to see whether, beyond the donation, is to see whether it's actually being utilized. And we are glad to report also that some of the schools that we sent the books in have now included reading to their timetable, which means that it was a necessary intervention. We also partnered with a publisher who put together a lot of past questions and how to answer questions to help some of our students who are writing their basic education certificate exam. And this project provides the final year students with revision textbooks and past questions and the solutions so that they can help prepare for their exams. And this is being rolled out as we speak currently across the northern part of Ghana. We're also putting together an integrated student empowerment program, which is to go into the secondary schools and to help students choose the courses they want to pursue and have hands-on experience with it. So, for instance, our plan is to take people from all walks of life in different industry to go and inspire the students, because for a lot of children, they don't have anybody back home who can even guide them to make the right choices going forward. I have a personal story. My nephew, actually he's my cousin, my young cousin. His mother was out of town. He'd finished his secondary school, and he needed to choose his course for university, and there was nobody around, so he chose somebody asked him to choose something, and now he's stuck with it at the university, very unhappy. And now the question is, how do we redress this? So empower students by guiding them So it's sort of a motivational program and also a career guidance and counseling program, which we're hoping to roll out by the end of the year. So that's what we're doing in education. Now, what is very dear to my heart is women empowerment. And most of my work is women biased, and rightly so. So we call it positive discrimination. So we really want to create an environment where women secure equal opportunities, rights, and increased voices in society. I mean, it's proven that even with companies where women are at the helm of affairs, the companies do better because women come with knowledge and heart to the job. So that's a good combination. So we have a few projects under empowerment, and one of the projects we're working on currently is what we call the Needles for Girls, which stands for Network for Enterprise Development Learning Through Sewing. So we're hoping to employ about 2,000 girls across the country in fashion-related activities. So these centers will train girls who have had to leave school prematurely and would otherwise have their education truncated, give them certificates. So we're working with the certifying authorities to give them certificates for their training so that they can, and then after training, we'll give them placement into job centers and fashion houses whom we are collaborating with. And if they want to further their education after the training, because of the certification we're giving them, they can actually go back to school from that level and further their education. And I'm glad to say that we're making good progress. We're working currently, the GIZ, the Germans, have committed to supporting us and some other companies in Ghana, and hopefully we'll roll out in the few months from now. And then another project is the Share Initiative project. So that's also to train 1,600 women across the northern part of Ghana. And maybe I may have mentioned the northern part of Ghana a few too many times, but it's for good reason, because it's the least developed part of the country. So we need to bridge the development gap in that part. And so we have 4 centers where we're going to process share. And in each center, we're employing 400 women, training them to pick the share and to process it. And then we have other programs that we're going to also, so entrepreneurial programs, women in farming, because share is very seasonal. So it's basically like a 3-month project. We're hoping to process all year round, but we can't put all 400 on payroll. So we are developing a program where after they've picked and they've made some money, we'll form a cooperative where we can give them loans, soft loans, so that they can start businesses, small businesses, even if it's providing them seedlings so they can farm and help feed their families all year round. So that's it really, that's starting in the next couple of months, where we're beginning the training soon, because the share season starts at the end of in April. So hopefully by the end of April we can start processing for our. Apart from what the NGO does, in my other life as well, I have a job with the UN Foundation. I believe Ambassador spoke about clean cook stoves. I think he's 2 months behind time because we've rebranded and we're now called the Clean Cooking Alliance. So it started as the Global Alliance for Clean Cook Stoves because that was where the mindset was at the time, but I quickly realized that clean cook stoves or clean cooking is not just about the stoves, it's about the energy that we use to cook. Of course, the stoves provide more efficient cooking, but at the end of the day, it's about the energy supply. So I know India is doing very well in LPG distribution, and the impacts that it has is immeasurable. The issues that arise from not using clean cooking technology includes it's detrimental to one's health. So we're looking at household air pollution and ambient air pollution. Last year I was in Geneva with the World Health Organization, and there was a first ever conference on health and environment, and it identified cooking as one of the main causes of ambient air pollution. So that tells us that there's a bigger issue that needs to be addressed. So beyond even the household air pollution, which is also major because we have all these interventions. So we're doing this safe delivery projects. But if you save the mother and the infant and send her back into a home that is full of carbon monoxide and toxic substances, you've really done precious little, because this child may be nourished, but they're going to die of other breathing-related diseases. And even the woman, it affects her lifespan, the quality of life. We look at a concept of time poverty, which is how much time women spend fetching firewood and fuels for cooking. And it's about it's too much time, which productive hours which she could have used to earn money. The girl child, productive hours where she could use to be studying, she's using to find firewood or even cooking. And because our cooking is so inefficient, it takes us 3 hours to cook one meal, and this poor child, this poor woman is sitting there slaving. Of course, men cook, but primarily it's women who go through these issues. So that is what I do with the Clean Cooking Alliance, and to promote clean cooking, to look at renewable energy, to look at how we save the environment at the same time and support our women by providing the solutions to them. So I'm very passionate about this, and I know India is really leading the way, and we're learning a lot. And Ambassador said this is not my first time in India. The last one was to speak on this matter. And after that, there was actually, I met with the minister, and he was so excited because we showed so much proactiveness from Ghana that they sent a delegation to meet with our energy ministry, and they are providing mentorship and support, training supports to Ghana so that we can also channel. We are also embarking on a cylinder recirculation program, and they're providing us with support on that and other things. I also convene a coalition with UNFPA which is called COPASH. So it's Coalition of Persons Against Sexual and Gender-Based Violence and Harmful Practices. So my first time in India, I was here to speak on human trafficking, which is a big issue for women, and especially in Africa and Asia. So this is part of the practices that we're advocating against and bringing awareness to, so that we have to speak up when we see something. There's so many harmful practices that are affecting women and girls especially, and we need to speak up. All of us have to rise up and speak about it. So those are, in a nutshell, some of what I do, not all of it. But yes, I thank you so much for your time. And I hope you leave here inspired to also do something for your community. Thank you so much.
Thank you so much, Excellency. Please, another round of applause.